The last time we had discussed about, fatty liver, NASH diagnosis, and I think we all have come to terms that we do have a huge population in front of us and an epidemic or a tsunami of fatty liver or non-alcoholic fatty liver diseases awaiting for us to see as clinicians, and more knowledge is needed to give to patients how they can eat healthy, how they can eat better. Not necessarily fast food or processed food, but small meals throughout the day for some people, or sometimes intermittent fasting. So I have with me my very good friend and great astute clinician and a gastroenterologist. So we will talk about the treatment of NASH or non-alcoholic steatohepatitis, because I think if we miss out on the treatment aspect, and especially the diet aspect of fatty liver, I think this will be an incomplete job for us, right?
Absolutely, Paramita. Again, thanks for having me here and all those nice things you say about me. When I was a really young doc many years ago, practice just getting out as a resident, so one of my patients told me, it looks like everything that I like to eat or do seems to be bad for my health. And you're telling me to do all the things that I don't like because they're good for my health. So it's become like a fact of life that the good things, the tasty stuff and all are not good for, whether it's a heart attack, stroke or fatty liver, whatever, and the things that are not really good for you end up being something that we need to take. Yeah.
Right. Now, the other thing that I'm seeing is obese patients have a much faster progression of the fibrosis from stage 0 to 4. Obese patients or diabetic patients have a faster way of, this is going much faster than regular other people would be.
Oh yes, so if you have two identical patients who are obese and diabetic with the same stage of fatty liver, and one stays obese and diabetic, kind of not very well controlled, and the other one loses weight and has a really tight control of blood sugars, after 10 years, this person will have much more advanced level of damage than the person who's lost weight and took control of his diabetes.
And people who are watching, I really want to mention, if your physicians have told you that you have fatty liver or you have a little bit of fat deposition in the liver, it's not a simple fat in the liver. It is much more than that. Definitely start approaching your physicians and ask them more questions about this. Now, coming to the treatment, which is, we don't have much. I still kind of do a lot of reading, and which is just to keep up with medicine, and I have been pretty much seeing to a lot of diabetes, heart failure, heart attack and stroke patients, which has given me kind of a little bit more confidence in treating these fatty liver diseases, because eventually you are changing the lifestyle. Because the minute you tell a patient that you are going to be on a diet, it is not feasible. So if you want to change everything on a Monday morning, it's not going to happen. Several Mondays are going to come, and you are just going to continue gaining weight. So these has to be done in a very slow process. It could just be one food that you are giving it up, or maybe not even giving it up. You're just eating once a month instead of eating it every single day. So you're still enjoying, but having a different uptake, towards the whole paradigm of the fatty liver.
I want to say that I'm really impressed by the way you brought up the thought of making the patient do some lifestyle changes, because that's really the key, and not just say, oh, it's not going to happen on a Monday morning. You got to go again and again back to the patient. It takes time and effort, and I really like your approach, because one of my favorite proverbs is a journey of 1,000 miles begins with a single step.
Right.
So you got to start somewhere. If you say, oh, he's not going to stop eating burgers, or he's going to stay this and move on to the script and move on, our patients who come to us with faith, who place their health in our hands, we are not doing them justice.
Right.
So I think what you're doing is really right, and I think you tell them, I tell them, they read more literature, the papers about, I think all of that will have a cumulative effect. Something like smoking causes lung cancer. So at some point, even if 10% of patients with fatty liver decide to mend their ways, lose their weight, stop eating bad foods, and therefore prevent going into cirrhosis, I think we should pat ourselves on the back.
Yes,
right?
definitely.
So I make it a point. I take time off from any patient encounter. I see somebody with a fatty liver. I just stop what I'm doing. And I can do endoscopy, I can do biopsies, I can do a lot more things. But what is going to save the patient's life 20 years later? Maybe that 5-minute chat I have with them.
Absolutely.
So if it doesn't work, it doesn't. But 1 out of 10 patients goes back and turns around, then I've done my job.
I have got a lot of good response with intermittent fasting. I do the 8-16 fast. So basically, I eat for 8 hours. So I do yoga in the morning, exercise in the morning, and then I start my day with a very good breakfast. I eat everything. I eat everything which is nutritious food, not processed food. So I eat real butter. I eat real sugar. I do not eat or add much sugar to any of my food, and I go for natural kind of fruits and stuff to have that sweet tooth, and then I have a very good lunch, and that's it. After that, of course, it's very, very difficult. It's not an easy process, and when I come home and I'm seeing my daughter is eating a pizza with her dad, and it is very, very difficult. You need to have a lot of willpower, but I think that intermittent fasting is going to be the answer to a lot of our questions. What is your take on that?
Absolutely, and first, congratulations on the 70-pound weight loss. It's a phenomenon. I've seen you, and it was like, where's the rest of you, Parmita? It was like you're half your size. So I've seen really good results from IF, from a lot of patients, colleagues, and even people who are not obese, who wanted to put on some muscle or get bulked up, all kinds of physical goals. I think IF really helped them come along. For those who are not having the willpower to do this, or the lifestyle does not permit it, I think it's back to the basics kind of a thing. I tell them that there's a list of things to avoid, list of things to do. So I'm sure everybody knows this, but just to reinforce, you avoid obviously the bad fats, the saturated fats, and you avoid the simple carbs. Simple carbs means sugars, candy, soda, anything with added sugar, and white rice, pasta, or bread. These are all. This is simple carbs are as bad, if not worse, than fats. That's not a well-known fact, but you're not doing yourself if you avoid a fatty, like a fried food, and eat white bread instead. It's the same thing. White bread becomes fat in the liver. So these are to avoid. And what to eat more of is eat more all the good stuff, all the things that you don't like the taste of, is good for you. So you eat the greens, broccoli, carrots, cauliflower, oatmeal, bran, all the good stuff, and then you throw in less proven but maybe helpful, or avocados, which are good fats for the liver, and then your berries and your green tea, that's kind of postulated to decrease.
This is interesting, because this is something that I did not know, and I came to know just a few months earlier, that caffeine or coffee can actually increase fatty liver.
That is a good thing,
And that is such a fascinating thing.
I think there's nothing to beat what we talked about earlier, like exercise and diet to reduce weight and control diabetes. Because if you do this, then it's just not your fatty liver that's going to get fixed, but it decreases your risk of heart attack, your stroke, your well-being, and your longevity, your decreased risk of cancer, because fat is a carcinogen. So I think while we wait for the magic pill for fatty liver, I think hitting more on these twin targets of weight loss and sugar control in diabetics will be much higher in terms of return on investment and time spent with the patient.
Now, before I end the discussion, I definitely want to ask you about hepatocellular cancer, because although we don't want to think about it, but a lot of people will get hepatocellular cancer. And my knowledge on that is not very sound. So I'm going to learn a little bit from you as to the whole transition from from NASH to hepatocellular cancer. How does that occur, and what do you do?
Yeah, so I'll touch that in just a minute, but I wanted to comment on a couple of things you said.
Sure.
So one is weight loss. We must be careful because some of us can get carried away, especially patients when they hit the formula for weight loss. Rapid weight loss can really make things worse. It can cause worsening of the liver disease. So we must be careful not to do more than 2 pounds a week, to maybe target 10-20% of body weight to lose, not more than that. And 2 pounds a week is the upper limit. I tell my patients to stick with a pound a week to make it really healthy, slow to lose, so it's harder to put back on.
And then drastic weight loss can also cause you to have gallstones. Another thing, that if you suddenly lose weight, you have a gallbladder attack, and then you are back to the hospital having a cholecystitis and having your gallbladder removed. So I completely agree with you on that. That slow weight loss is definitely wanted.
Yeah, and then alcohol in non-fatty liver patients is probably fine, and I would still hate to say that a toxin is acceptable. I won't be caught on camera saying that, but definitely somebody with steatohepatitis, NASH, as with increased liver enzymes or inflamed liver on liver biopsy, it's definitely a toxin, because that's definitely going to even an ounce or two is going to make things worse.
Absolutely.
So I would wait probably till the inflammation comes down by diet or exercise or whatever before I let the patient drink. But otherwise I tell them, you have NASH, you have a liver that's inflamed, you're pouring more toxin into the liver. So that's the thing.
One thing I don't know what is the rule in here, and I go by patient to patient basis, which is the use of statins. I have a person whose cholesterol is 300, and I need to bring the LDL down, but then has NASH. So what do we do exactly for those?
Yeah, statins have been tried, and some reports are good that they actually help people with NASH in the long run, but it's not proven. So if you have a clinical indication for a statin, then go ahead and use it. But I won't expect it to really do any good for the liver.
But at least it's not doing any harmful things for the liver, right? Because the liver function can go up a little bit, and I have seen that. But I tell the patients that, look, it doesn't matter, it just went up a little bit, but in the long run, it's actually helping your heart and other areas of the body.
Statins can very rarely cause liver cell damage by other means. So if they're going up, then we monitor. Typically, if it's not damage from the statins, after a few weeks or months, they come back to where the patient was before. So the carcinoma, as a number, it's very, very low. But like you said earlier, we don't know which person is going to be draw the short straw. So out of the 200-300 million people on the planet with fatty liver, 20% go on to become NASH patients. That's inflammation of the liver. And out of those 20%, just about 20% go on to have fibrosis that goes on to become cirrhosis. So of that, again, there is a 5 to 10% of those decompensated cirrhosis. Of that, there is a 2 to 3% of those really become prone to development of liver cancer. So the real numbers are very, very small, but the threat is there. I won't like to have even a 1 in 1,000 risk of getting liver cancer, which sometimes is not even curable by liver transplant. If it's bigger than a certain size, it's beyond liver transplant. So it's a death sentence. So this is not a benign condition by any chance. It has to be taken really seriously by the patients, by us physicians, and the family involved. So it's a social thing.
You brought up a very important topic, family, and all our celebrations occur around food.
Yes.
And that is something I want to change, but it is so difficult. So for birthdays we have celebration.
It's cake.
And we have cake, and we have celebration for almost everything that we can imagine is associated with eating.
Alcohol.
So yes, and alcohol. When we are happy, we can drink, and that is the typical feeling that if you're happy, you need to eat. I think that has a bigger responsibility as the citizens that we can bring out other things which can be happiness as well. Maybe make our own dish for you which has less fat, and go to the party and trust me, there is some amazing recipes you can find which are very low in fat and low in carbs, and they taste great. You don't have to be eating protein bar and protein shakes. I myself do not eat protein bar and shakes because they're processed food. If I have apple in my hand, I prefer that any day over apple juice. If I have an orange itself, I do not go for the orange juice, and I really want to stay in the area of non-processed foods. And I'm trying to get more and more awareness of non-processed foods. So sometimes when I go to someone's house, I probably will, instead of taking a cake, I might carry a watermelon for them, which is going to be sweet and give them the same good feeling, but not having the bad effects of the sugar or sweetness.
So don't eat or drink anything out of a box, bottle or can.
Wow, that is excellent.
So
I think that's a very good tip.
And then I think the good stuff, by all means, your birthday comes once a year, you should have cake. You should have a little bit sins here and there to not to deprive yourself, but we should keep those for celebrations, like special occasions. You have cake or something that's not going to be really healthy, but to make a daily habit of drinking Coke or sugary or eating candy, that's probably something that we need to educate ourselves, our kids, our society, and everybody else.
Absolutely. No, I agree with that. And it has been an absolute pleasure to have you, because
it's my
I
pleasure,
learned so much
yes.
from you today, and hopefully I will be able to get that to my practice and continue working with him in next videos as well.
My pleasure, Parmita. Thank you. Thank you all.